with the cardiovascular system, really, it's important to remember that cardiovascular. One is talking about the heart, which is cardio, and the vessels is part of that. And with the heart really is located in the mediastinum, which means in the thoracic cavity, in the mediastinum, right in the middle. But really, to be accurate, one has to say towards the left lung, which is why we will always find that the left lung only has 2 lobes in order to make room for the heart, while the right lung has 3 lobes. But anyway, that will be looked at when I cover respiratory medicine. So the heart is located in the slightly to the left in the mediastinum, and it has 3 layers itself, but it is contained within a sac that is called the pericardium. The role of the pericardium really is to keep the heart in one place, like to retain it in its position in the thoracic cavity, in the mediastinum, and to also reduce friction, and indeed to protect the heart and to produce pericardial fluid, which lubricates the heart and reduces friction when the heart is beating. So if we were to dissect a person, open up the ridge, push out the lungs, that top layer that we'll see is indeed the pericardium sac, which I've just covered. It is a fibrous sac and it's quite tough and strong, because obviously its job is to contain the heart and reduce friction and protect the heart. So it is tethered superiorly at the vessels and also at the apex of the heart. So it actually keeps the heart nicely in place. So if we were to cut the pericardium away, the next layer that we'll find is actually the layers of the heart itself. So the first one on the outermost aspect will be the epicardium. And the epicardium is made up of connective tissue. It also has adipose tissue, and it also has elastic fibers, really, to allow free movement. So the epicardium also, if we were to look at it, so if we were looking down on a dissected specimen, we would also find the coronary arteries and coronary veins lying directly onto the epicardium itself. So that is its function, really. And then if we were to dissect and peel away that epicardium, we'll then find the myocardium, which is the actual heart muscle. And obviously when we say myo, we have to remember muscle. So this is muscle fibers. The heart is made up of smooth muscle fibers, which actually are able to generate action potential. A single unit of a muscle contraction is called the sarcomere, and that is the basic unit of a contractile structure. And the sarcomere obviously will have myosin and actin, and obviously we know that in contraction actin move away from the Z bands and moves towards the middle, whilst the myosin remains tethered in place, bound to its place on that Z line. So each muscle fiber as well has gap junctions, which allow for movement of ions, which also allow for the propagation of an impulse and subsequent contraction. So again, I'll cover this in much more detail when I do physiology of muscle contraction. This is just the introduction of A and P. And then if we're, obviously the myosin is the thickest layer of the heart. And then if we were to peel away all that myosin will then arrive at the endocardium. The endocardium is the innermost, and it is lined by the endothelium. Obviously, the endothelium, we all know, is nice and smooth, and it allows for easy and smooth flow of blood within lumens. The endothelium obviously is continuous inside as the innermost layer of the heart, covering all the inner layers of the heart, the valves, and the vessels themselves. So it is quite continuous, and that obviously allows for a continuous smooth flow of blood. So now we've just covered really quite quickly what structures are and where they are found. So now we'll do a bit more detail in terms of the basic introductory anatomy and physiology. So the heart itself is a pump, which just means that it pumps blood around the body. So it has 4 chambers, which we can draw like this. It's easy to just draw them like that. It's really just for ease of reference. So this is the right heart and this is the left heart. So the right side of the heart, which we call the right heart, has a right atrium and a right ventricle. The left side similarly has a left atrium and a left ventricle. The important thing to remember is that the left side of the heart is much more muscular. It has a very, very thick muscle, and that is due to its function as the main pump that actually pumps blood out of the heart into the body, pumping out oxygenated blood to feed the entire body, including the heart itself. So the heart also has valves, and valves are obviously structures that facilitate one-way flow, a one-way flow system, and prevent backwards flow. So in between the right atrium and the right ventricle, we have a tricuspid valve there. So this is tricuspid valve, tricuspid valve, which has 3 cusps, hence its name, tricuspid. And this is also called a right atrioventricular valve. And then between the right ventricle and the vessel, we have a pulmonary valve. And then the name of this vessel is called a pulmonary artery. So I just write PA there. And the important thing to remember that while the pulmonary artery is indeed carrying deoxygenated blood away from the heart, it's still called an artery. And the easiest way I remember things is by just saying to myself, okay, arteries carry blood away from the heart and veins bring blood back to the heart. So that's how I always remember that this is always a pulmonary artery. So on the left hand side we have a left atrium, as we have said. We then have a mitral valve which sits there. And the mitral valve is a bicuspid valve. And between, again, is called a left atrioventricular valve. And then at the opening of the left ventricle, before we enter the vessel, we have an aortic valve. And this is the aorta. So the aortic valve is a tricuspid valve. The pulmonary valve is also a tricuspid valve. The aortic and pulmonary valves are called the semilunar valves as well, or the ventricular valves. Again, all of this is to generate a one-way flow system. And then, as we've said, the heart is a pump. But before I talk about how it pumps, I now want to talk about an important issue, which is that the heart, the basic unit of the myocyte, which is the sarcomere, obviously has a impulse generating function. This is done by the SA node, which is found at the right atrium. So the right atrium really is important for generating that impulse, and impulse is important for the contraction of the whole heart. So it is generated at the right atrium, and it travels down into the AV node. So we'll call this the AV node, which is located in the atrioventricular septum. Well, in the septum, really. Let's just call it in the septum. And when impulse is generated, obviously it travels down to the AV node, and from the AV node it travels into the bundle of His, down the septum. So it is traveling down the bundle of His. The bundle of His gives off a few fibers, which are called Purkinje fibers. And we have the left ones which go on to depolarize the left ventricle. Similarly, the right ones depolarize the right ventricle, and all of the depolarization of the left and right ventricles happen simultaneously, causing both chambers to contract at the same time and expel blood into the pulmonary valve and into the aorta simultaneously. Similarly, the depolarization and the contraction of the right atrium and the left atria work simultaneously again and expel blood into the right ventricle and the left ventricle through the tricuspid and mitral valves, respectively, and simultaneously again. So now we have covered the chambers, we've covered the valves, and we've covered the vessels that leave the ventricles. So now I'm going to talk about the vessels that arrive at the atria, at the chambers, at the upper chambers, the atria. So we have, on the right atrium, we have the superior and inferior vena cava joining together and bringing blood from, so this is the superior vena cava, this is the inferior vena cava. They bring blood from the superior aspect of the body, that is the head and neck, and the inferior, and the a bit upper body here, really, neck. And the inferior vena cava brings blood from the rest of the body inferiorly. So all that blood, usually the superior and vena cava, there is a azygos vein, which joins the inferior and superior vena cava together. But the important thing really is that all of those then drain into the right atrium. So we have deoxygenated blood coming into the right atrium. Another important part of where I'm going to cancel this out so I can have more room. Another important source of deoxygenated blood that comes into the right atria is blood that is coming from the coronary sinus themselves and the great veins. So right, coronary sinus, and obviously it gets it's fed by the great vessels and the small great veins, not vessels. So this is the coronary sinus, and the coronary sinus collects deoxygenated blood from the heart itself. So this is blood that is coming from the myocardium itself. So from feeding, remember when I said the epicardium has all the coronary vessels. So this is the coronary sinus collecting deoxygenated blood from from the heart. So now we can safely say that there are three sources of blood, of deoxygenated blood that enter the right atria. This is number one. We can say superior vena cava, inferior vena cava is number two, and the coronary sinus is number three. I know it really is a side note. One of the veins, I think it's the small one, or is it the medium one? So don't quote me on this. I'll have to look this up. I've just realized a gap in my knowledge. So one of the veins actually drains directly into the right atria without joining in the coronary sinus. And then on the left hand side we have the pulmonary veins. Bringing blood back from the lungs. So now we are going to start the flow of blood. I'm actually going to have to use a black pen for this. And so we have blood from three sources. It comes in from source number one, source number two, and source number three. It all drains into the right atria. An impulse occurs, depolarization of the atria occurs, the atria contract, and the atria contract, and blood comes from all the three places, and as it fills, the atria then contract. Yes, impulse is generated in the atria contract, the tricuspid valve opens and allows blood to flow into the right ventricle. So an important aspect really of these atrioventricular valves is that they are held in place by cord-like tendons there, and the cord-like tendons really just join onto the papillary muscles. They are cord-like tendons. They join into the papillary muscles, and their function is to keep the valves in place and to allow the valves to shut even when they are under pressure, and to ensure that when they shut there is perfect alignment. For example, say it's just like this, there is perfect alignment, which will not then allow blood to perhaps either flow back into the atria, but indeed blood will flow back following the downwards route towards the vessel. So the tricuspid, once the atria contracts, the tricuspid valves opens, receives blood, allowing the right ventricle to receive blood, and as the tricuspid valve opens, the pulmonary valve is closed at the time. So we're starting with a closed system to make life easy. So it continues to fill, and as it fills, the pressure within the ventricle obviously continues to increase as it's filling and enlarging. So as it fills, it becomes full, the tricuspid blood pushes back against the tricuspid valve, which then shuts, and then allowing pressure, even more pressure to build up. And then this will be, all of this, what I'm talking about now, will become much more better when I talk about the cardiac cycle. And as pressure builds up, it then forces the pressure in the ventricle becomes much more than the pressure in the vessel, which then forces the pulmonary valve to open. Excuse me. And all that blood becomes deposited into the pulmonary artery. So now we have all the blood from the right ventricle into the pulmonary artery. It then goes into the lungs to receive its oxygenation. So we have our alveolar there, waiting to undertake gaseous exchange, which occurs. We have oxygen going in and carbon dioxide coming out and being expelled into the air through the nose or the mouth. And then now we then have oxygenated blood. I'm going to change to red to make life a bit easier. So oxygenated blood then exits the lungs via pulmonary veins and comes in and enters the left atrium of the heart. So we have our oxygenated blood is now draining into the left atria. And again, depolarization, which is the same depolarization that happened at the SA node, causing the right ventricle to contract. It's the same. It occurs causing the left atria to contract. The mitral valve opens. Blood enters the left ventricle. And the same thing occurs as ventricular depolarization occurs. The aortic valve opens, allowing blood to enter the aorta. And as blood enters the aorta, it is then distributed to all the body systems. So we'll have our body systems there. And the first organ to be fed with oxygenated blood is the heart itself, and it is fed via the right coronary arteries and the left coronary arteries. And then the aorta ascends. This happens really at the level of the sternal angle, where the aorta ascends, forms an aortic arc. So if we're just to look at it from an anterior aspect, we will have the right and left coronary arteries going on to feed the lungs, and then the cardiac muscle itself, the heart itself, and then the aorta will ascend like that, form an aortic arc, and then descend into the thoracic cavity, the abdominal cavity, and into the up until the level of the iliac, where it then divides into the right and left iliac, which in turn divide into the femorals, and then all the arteries into the legs, like I'm not going to do that. I'll do that when I do the vascular system, the great vessels. So the first branch on the right hand side is actually called the brachiocephalic. I'm actually going to use a different pen because this pen doesn't work terribly well. It's actually called the brachiocephalic. So we have a brachiocephalic on the right hand side. So that brachiocephalic then